Hi, this is Amber Darst, Dental Insurance Coordinator for Managed Outsource Solutions. For this podcast, I'll be discussing the different services and coding for dental hygiene. So, not every patient who walks into a dental office for a cleaning is going to get the regular everyday prophy. There are actually a handful of different ways it could go, depending on the patient's oral health condition. So, let's discuss the different scenarios. First, there is the standard prophy, the D1110, which is an adult prophy. This code is used to report a preventative service for patients who don't have any signs of periodontal disease. The procedure includes scaling and polishing of all teeth surfaces. And then we have the D1120, which is a child prophy. Same as the adult prophy, except this is for children aged 13 or younger. Now remember, when billing for a child prophy, be aware that the 1120 code involves primary and transitional dentition. While prophy codes are dentition specific, many plans are age specific. So an adult prophy cannot be replaced as a child prophy in order to satisfy age limit constraints of a dental plan. And then we have the D4346. This code is to be used when a hygienist performs scaling in the presence of generalized moderate or severe gingival inflammation, the full mouth, after an oral evaluation. It is used for permanent, primary, or transitional dentition, and there is no age limit, and is based on the diagnosis rather than the intensity of treatment required. Also, this code should not be reported in conjunction with a prophy, scaling and root planing, or a debridement procedure. So that takes us to the full mouth debridement, which is the D4355. A full mouth debridement is necessary to enable a comprehensive oral evaluation and diagnosis on a subsequent visit. This is a preliminary superficial removal of plaque and calculus. Implementing a full mouth debridement for the purpose of completing an assessment and evaluation will be essential to generate an accurate diagnosis and develop an appropriate treatment plan. A second visit would be scheduled for an exam and the appropriate hygiene visit. We have a D4341 and D4342. These are used for periodontal scaling and root planing. The 4341 is when it involves 4 or more teeth in the quadrant. The 4342 is to be reported when it involves 1 to 3 teeth in a quadrant. This is a deep cleaning that goes below the gum line. This procedure is a forerunner of the periodontal maintenance procedure, which leads me to the D4910, periodontal maintenance. Periodontal maintenance is a cleaning that aids in halting the progression of periodontal disease. Once a patient begins the periodontal maintenance, they will remain a perio patient unless the doctor deems the gums once again healthy enough to return to a regular prophy cleaning. In cases where the patient's benefits may have limits around the coverage for this procedure, you are still legally bound to report what you did and code as such. A helpful narrative could say that if a periodontal maintenance is denied, please provide the alternate benefit of a prophy. And to minimize claim denials for periodontal therapy and maintenance, make sure to always include periodontal charting as well as relevant x-rays to support your request for payment. And that's it. I hope this helps, but remember that documentation and a thorough knowledge of payer regulations and guidelines is critical to ensure accurate reimbursement for the procedures performed. Thanks for listening in.